Hello, everyone. Hello, everyone. This is Ewan from ENW. This talk today will be on irregular menses or irregular period. So we're going to talk about what irregular menses are. We're going to talk about some of the common causes of irregular menses, how it's diagnosed with traditional Chinese medicine, TCM, what are some of the treatment options available from both Western and Chinese medicine, and what you can do to help yourself if your menses are irregular, mostly diet and lifestyle. So some of the common questions that we get from patients here at EMW are something like, is it normal to have periods getting closer together? Or is it normal to have periods getting longer and longer? So before we talk about irregular menses, we need to know how we define what regular menses are. So some of the criteria that we are looking at to tell if someone's menses are regular are the length of a menstrual cycle, so which is the number of days between menses, counting the first day of your menses until the day before your next menses. Other criteria we're looking at are differences between the length of each menstrual cycle, the flow, and the total days of bleeding. So on average, the length of a menstrual cycle is 28 days, and plus minus 7 is still considered normal. So it's normal for your menses to be a bit shorter or longer than 28 days. So what regular menses are? So regular menses are menses that happen every 21 to 35 days, with no more than 7 days of difference between the shortest and longest menstrual cycle that lasts 2 to 7 days. And now let's talk about irregular menses. So your menses are irregular if they come more frequently than 21 days, or they go 35 days or more between menses, or there's more than 7 days of difference between your shortest and longest menstrual cycle. So your menses are also considered irregular if there's bleeding or spotting between menses, or you are getting heavier or lighter flow than usual, or your total days of menstrual bleeding, the total days of your menstrual bleeding become longer or shorter than usual. So for today's talk, we're going to focus on the irregular length of the menstrual cycle. And there are many possible causes of irregular menses. Some common ones include puberty. So it's normal for your menses to be irregular, and it can take up to 2 years for your body to get into a regular cycle. So if your menses just started less than 2 years ago and your cycle is not regular, there's probably nothing to be worried about. Menses also become irregular during perimenopause, which is the first stage of menopause. So during this time, hormone levels begin to fall, and your menses may get further and further apart until you stop having them entirely. Pregnancy, so your menses would be delayed or getting spotting during early pregnancy. So for pregnancy, just take a pregnancy test to rule this out. Breastfeeding, especially exclusive breastfeeding and frequent breastfeeding, can suppress ovulations, causing your menses to stop. Other is medical conditions such as PCOS, hyper or hypothyroidism, premature ovarian failure are also some of the common causes of irregular menses. Hormonal contraception, for example, birth control pills, intrauterine device, IUD, might also make your menses irregular, which is very common. Extreme weight loss or weight gain, stress, both mental and physical, excessive exercise, and poor sleep patterns may also cause irregular menses. So because we are seeing patients with fertility issues a lot here in EMW, so we are getting these questions very often, which is, can I get pregnant if my menses are irregular? And the answer to this is yes, if you ovulate. So your menses become irregular, being irregular doesn't conclude that you are never going to get pregnant, because it's all about ovulation. So getting pregnant is related to ovulation. So usually women with irregular menses still ovulate, just that they don't ovulate on a regular and a predictable schedule. So of course, if your menses are irregular and you don't know when you ovulate and when you are most fertile, your chances of getting pregnant are lower than your chances of getting pregnant are lower than those who have regular menses and regular ovulations. So if your menses are irregular, you can use an ovulation kit to check if you are ovulating, an ultrasound scan, or by taking vessel body temperature (BBT) to monitor your ovulations and have sexual intercourse during your fertile period, and to increase the chances of getting pregnant. So yes, if you ovulate, you can still get pregnant if your menses are irregular. Next, we're going to talk about what treatment options available from Western doctors for irregular menses. First of all, you might not be given any treatment if you are having irregular menses from time to time, and it's very common. Irregular menses due to puberty, perimenopause, or birth control pills also does not typically require treatments unless they bother you or if you have other underlying conditions that affect your menstrual cycle, like what I mentioned before. For example, PCOS, thyroid issues, premature ovarian failure, or if you have irregular menses and you're struggling to get pregnant. So one of the potential treatment recommendations may be hormone therapy. Birth control pills that contain the hormone estrogen and progesterone can help to regulate your hormone level, which can in turn help regulate your ovulations and also your menstrual cycle. Surgery can be done for patients who have polyps or fibroids, depending on the conditions. Thyroid medications for patients who have thyroid issues. And last but not least, for patients who are overweight or underweight, stress, those who exercise excessively or having poor sleep pattern, making a change to your lifestyle, your diet, and physical activities is one of the most important approaches, I would say, that may help to regulate your ovulations and menstrual cycle, and also increase your chances of getting pregnant. So I'm going to talk about what you can do to help yourself if you have irregular menses by making a change to your lifestyle, diet, and exercises according to your TCM syndrome diagnosis. So now let's get to the TCM part. In TCM, we have two different diagnoses for irregular menses based on the length of the menstrual cycle. Okay. Sorry, what was I? Based on the length of the menstrual cycle, which are early menstruations and late menstruation. So on average, the length of a menstrual cycle is 28 days, and like I said, plus minus 7 is still considered normal. So in TCM, if you have a menstrual cycle that is shorter than 21 days for at least 3 consecutive cycles, we consider it as early menstruation. And if it's longer than 35 days for at least 3 consecutive cycles, we consider it as late menstruation. So I'll explain a little bit about syndrome differentiation and TCM diagnosis before we move on. So TCM diagnosis relies heavily on the gathering of information around signs and symptoms. So we look for patterns and group them as a certain syndrome, like blood heat syndrome or Qi deficiency syndrome. And that process is called syndrome differentiation. So these syndromes then form the diagnosis. So that's the TCM diagnosis. So I'm going to talk about some common syndromes that we see in patients with either early or late menstruations. And I'll also be giving advice on what acupuncture points that you can do acupressure on by yourself at home, and advice on diet and lifestyle according to those syndromes. So you would see how we group those signs and symptoms into different syndromes. And if you find yourself fitting into a certain syndrome, then you can follow our advice accordingly. So we're going to talk about early menstruation first. And the most common syndromes that we see are blood heat syndrome and Qi deficiency syndrome. So the first syndrome of early menstruation is blood heat, and it's called 血热 in Chinese. And the symptoms associated with blood heat include early and heavy periods, dark colored and thick menstrual blood, clots in the menstrual blood, heat intolerance, agitation or anxiety, or people who tend to have acne, dry, or sore throat. And for patients with blood heat, their tongues are normally red in color with a layer of thin yellow coating. So some common causes of blood heat are emotional stress or strong emotions, usually anger or frustration, or ongoing worry or anxiety might also cause blood heat to happen. And diet rich in heaty foods like fried, spicy food may also cause blood heat. And external heat from prolonged exposure to radiators, the sun, and fire may also cause blood heat. So what can we do if we have blood heat syndrome? TCM treatments focus on clearing blood heat using acupuncture, Chinese herbs, cupping, scraping, and so on. And there are two acupuncture points that 血海, which is 血海 and 曲池, that you can press and massage at home if you have blood heat syndrome. So I'm going to show you the location of those points in the next slide. Diet-wise, avoid fried, oily, spicy food. Also stay hydrated because it helps you to cool your body by drinking enough water. You may also add chrysanthemum tea and green bean soup to your diet if you have blood heat syndrome. So the two acupoints, SP10 and LI11, which is 血海 and 曲池, there are two acupuncture points that we normally use for blood heat syndrome. The first one, SP10, 血海, located between, so here, the inner side of your, so it located between the inner side and top of our thigh, 2 inches above the inner side of our kneecap. So this is your kneecap, and then upper, and then inner side. So it goes up 2 inches, and there's a bulge of the inner portion of our quadriceps femoris muscles, so as shown in the picture. So which is around here. And after you have found the locations of any acupuncture points that we're going to talk about later, can use deep and firm pressure to massage and stimulate each point. So you can use your thumb and then massage in like a circular motion for about 1 to 2 minutes. And you can repeat doing this every day. And then the next one is LI11 Qu Chi, which is located on the outside of our elbow, which is here, in the middle of the bone structure, olecranon. So there's a bone structure here, and the end of the crease. So there's a crease inside of the elbow. So it's in the middle of the bone structure and the crease. So it's somewhere around here. Okay. So these are the two acupoints that we use for blood heat. And then the next syndrome of early menstruation is Qi deficiency. And the symptoms associated with Qi deficiency include early periods, pale and thin menstrual blood, fatigue and pale, dizziness or shortness of breath, low backache, and so on. And for patients with Qi deficiency, their tongues are normally pale with a few red spots, teeth marks, and a layer of thin white coating. And some common causes of qi deficiency are lack of physical exercise, overwork or constantly on the go, like leaving no time to relax, or excessive worry. So according to TCM, these causes may drain the body of energy or qi, making a person more susceptible to qi deficiency and the illnesses that follow. So TCM treatments focus on tonifying qi of spleen and kidney using acupuncture, Chinese herbs, moxibustion, and so on. And there are also two acupuncture points, qi hai and zhu san li, that help with qi deficiency. And diet-wise, avoid refined sugar, dairy, and iced foods or drinks. And for people who may work too hard or are always on the go, you may focus on getting enough rest and improving your sleep pattern, like taking breaks throughout the day, making time to take a nap, finding a set time to go to sleep and wake up each day. Also getting at least 7 hours of sleep each night. Also doing some relaxing activities such as Tai Chi, yoga, or Qigong can also help with Qi deficiency. You may also make tea with American ginseng or astragalus, Huang Qi, to help tonify your Qi. And the two acupoints for Qi deficiencies are CV6 Qi Hai and ST36 Zhu San Li. So these 2 points are two common points we use for Qi deficiency. CV6 is located along the middle line. So this is your belly. It's located in the middle line of the front side of your body, about 1.5 inches below our belly button. So this is our belly button. So about 1.5 inches below. And this is what we call qi hai. And for ST36, it's located on the front side of our lower leg, 3 inches below the base of our kneecap. So this is our knee, and then this is the base of our kneecap. And then on the outer side of our lower leg, 3 inches down, so about 4 fingers width away. So 3 inches. So from here, go down 3 inches. And roughly 1 finger away from the shin. So this is your shin, 1 finger away from the shin of the outside. So this is Zhu San Li. And we've talked about 2 common syndromes of early menstruations, which are blood heat and qi deficiency. And now we're going to talk about late menstruations. And the most common syndromes that we see are kidney deficiency, blood deficiency, and phlegm and dampness syndromes. The first common syndrome of the late menstruation is kidney deficiency. The symptoms associated with kidney deficiency include delayed and scanty periods, pale and thin menstrual blood, clear and watery vaginal discharge, lower back pain and knee pain, dizziness or tinnitus. And for patients with kidney deficiency, their tongues are normally pale with little or no coughing. And some common causes of kidney deficiency are inborn insufficiency, chronic diseases, long-term chronic diseases, and excessive sexual activities. So TCM treatments focus on tonifying the kidney using acupuncture, Chinese herbs, and moxibustion. The 2 points that we use for kidney deficiencies are Guanyuan and Shenshu, which can help with kidney deficiency. And for people with kidney deficiency, balancing your work and life and getting enough rest are crucial in order to improve the function of your kidney. Also, avoiding excessive sexual activities may help as well. You may also make tea with red date, goji berry, or mulberry seed to help tonify your kidney. So the 2 points that we use for kidney deficiency are Guanyuan CV4 and Shenshu BL23. CV6 is located the same thing, the middle line on the front side of your body, which is this is your belly. So about qi height was 1.5 inches down your belly button, and for Guanyuan is 3 inches below our belly button. So this is the Guanyuan here. And for Shenshu BL23 is located on our lower back at the level of the lower border of spinous process of the second lumbar vertebra, and it's roughly 1.5 inches away from the middle line of the vertebra of our back. So it will be harder for you to find it yourself. And if you don't know when, if you don't know where the second lumbar vertebra is, you can just do acupressure at your lower back along the meridian, which runs along the lines of 1.5 inches away from the middle of your back. So it's the middle and then 1.5 inches away for both sides. And this line that runs through on your lower back, you can just do some massage around here. So it would be beneficial for kidney deficiency patients. And the second syndrome of the late menstruation is blood deficiency. So the symptoms associated with blood deficiency include delayed and scanty periods, pale and thin menstrual blood, pale face and lips, dizziness and blurred vision, palpitations, and insomnia. And for patients with blood deficiency, their tongues are normally pale with little or no coating. And some common causes of blood deficiency are profuse blood loss, both internal and external, could be due to trauma, childbirth, or heavy menstruation. And also diet, like overeating, more of like eating habits, like overeating, undereating, picky eating, eating too fast or eating too slow, eating under stress, can also lead to blood deficiency. Physical or mental overexertion over a long period of time, and chronic diseases can lead to both blood and qi deficiency. And TCM treatments focus on nourishing blood using acupuncture, Chinese herbs, moxibustions can help as well. There are also 2 acupuncture points here, Zhu San Li, which we have mentioned before, and San Yin Jiao that help with blood deficiency. And for diet-wise, people with blood deficiency should take in more dark leafy greens like spinach and kale, black beans, nuts and seeds like black sesame, or dark fruits like grapes. And also avoid raw vegetables, seafood, and cold fruits. So same as people with qi deficiency, you may also want to focus on getting enough rest and improving your sleep patterns. And you may also make tea with red dates, goji berry, longan, ginger, brown sugar to help nourish your blood. So ST36 and SP6, 2 common points that we use for blood deficiency. So we've talked about ST36 Zhu San Li in qi deficiency. So these points can basically help to tonify your qi and also nourish your blood. So we're doing these acupoints quite frequently. And the next one, SP6, San Yin Jiao, is located on. So this is the inner side of your lower leg, of our lower leg, and this is the highest point of our the knee, the ankle, and then it's also roughly 3 inches above the ankle. So this is our tibia bone. So it's at the slightly next to the border of our tibia bone, and then 3 inches up our ankle, the tip of our ankle. 3 inches is around 4 fingers. So this is the point San Yin Jiao, and this is quite a sensitive point also. And then the last syndrome of late menstruations is phlegm dam. The symptoms associated with these syndromes include delayed or scanty periods, thick and sticky menstrual blood, excessive vaginal discharge, which is usually thick and sticky, overweight or the feeling of chest fullness, heavy limbs, fatigue, and water retention. And for patients with phlegm dam syndrome, their tongues are normally pale and swollen with a thick layer of white coating. And some common causes of phlegm dam syndromes are emotional stress, external wind, cold, heat, and dampness from the environment, excessive intake of fried or greasy foods like dairy, milk, and cheese, and also sedentary lifestyle. And in TCM, dampness and phlegm develop when digestions and the fluid metabolisms are sluggish. So it's really important to emphasize on supporting a healthy digestion in order to resolve this, the phlegm and dampness in your body. So TCM treatments focus on improving digestive functions using acupuncture, Chinese herbs, moxibustions, which can help to improve your fluid metabolism. And there are also two acupuncture points, Zhongwan and Fenglong, that help with phlegm dam. And diet-wise, people with tanshi should avoid foods that contribute to dampness and phlegm, which are cold drinks or food, alcohol, dairy, refined sugar, spicy, greasy, and raw foods. And taking in more vegetables and complex carbs. Regular exercises would also help. You may want to make tea with orange peel, lotus leaf, and hawthorn, sanja, heye, and chenpi to help improve your digestive function. And 2 points that we use are CV12, Zhongwan, and Fenglong, ST40. So CV12 is also located in the along the middle lines of the front side of our body. So it's upper. So this is your upper abdomen. And it's the middle. So this is your belly button, and this is the sternum, and this is the slightly underneath the sternum. So it's in the middle. It's between our belly button and the sternum. So half here, 4 inches, 4 inches. It's in the middle. So this is what we call zhongwan, and it's very good to improve your digestion. So if you have bloatedness or distensions in here, so you can also use these points to help improve your digestion. And ST40 is located on the front side of our lower leg. It's also in the middle of our knee and ankle. So this is the lower border of our kneecap, and this is the tip of our ankle on the outer side of our leg. And then it's also half here, about 8 inches here. And it's about 2 fingers away from the shin of our lower leg. So we've gone through 5 different syndromes for both early and late menstruation in TCM. So when do you have to see a GP? So you have to see a GP if your menses pattern changes and you're under 45, or if you have menses that occur less than 21 days or more than 35 days apart, or if there is a big difference, at least 7 days, between your shortest and longest menstrual cycle. Also, if you have irregular menses and you're struggling to get pregnant. So there might not be anything wrong, but it's always a good idea to get checked out to see what the cause might be, or just to rule out that there aren't any health problems. So you might be referred to a gynecologist, if you need any test or treatment. And you may also come to us for TCM consultations or assessment if your menses are being irregular. So this will be all for today, and thank you so much for listening. We have some questions coming in here. Well, cold water cause irregular menses, and how does it cause? So cold water, in TCM, cold water is considered as cooling, so it might lower down your circulations for both blood circulation and chi circulations. So might not directly cause irregular menses. It also depends on your body constitution. So if you have more towards a phlegm, dam kind of, or a chi deficiency or blood deficiency kind of body constitutions, then you might want to avoid cold water. Does menopause equal to irregular menses? And does perimenopause cause irregular menses? So yes, when your body is getting into the stage of menopause, the first stage would be perimenopause. Your hormone level will start dropping, and this is when your menses will start getting a little bit irregular, and it is normal if you are over, say, on average, it's 45 years old. So there might not be something to be worried about if you are almost 45 and then your menses start getting slightly irregular. Of course, you can get it checked up to see if it's really menopause. And that will be all the questions. Thank you so much. So I'll see you next time.